Trent. Tererai Trent was born and raised in Zimbabwe, rural area where oftentimes sexism and poverty kept women and girls in a disadvantaged position. The first 30 years of her life were a true testament to the social and gender inequalities experienced in many in the developing world. After years of hard work educating herself and raising a family, she came to the US, where she earned a bachelor's degree in agricultural education and a master's degree in plant pathology. Tererai then moved to Little Rock, Arkansas to work at the headquarters of the Heifer International as Deputy Director of Planning and Evaluation. Her work has taken her to 5 continents to document the impact of Heifer's work around the world. With more than 15 years of international experience, she brings together viewpoints from both the developing and the developed world, if we must use that term. From 2005 to 2010, she was involved in a major impact assessment that spanned 30 countries worldwide, led by Dr. Michael Scriven, an eminent scholar of international renown, well known for his seminal contributions to the establishment of logic and evaluation, or the logic of evaluation. She has conducted meta-analyses of multiple evaluations of HIV/AIDS prevention programs in Sub-Saharan Africa, with a special emphasis on the implication for women and girls. These evaluations focused on major implications in bilateral and multilateral agencies such as USAID, PEPFAR, the World Bank, UNAIDS, NORAD, and CETA, and their evaluation of HIV prevention practices in the region. Most recently, she served as a research fellow at UCSF AIDS Research Institute Center for AIDS Prevention Studies, the world's largest research center dedicated to social, behavioral, and policy science approaches to HIV. And I'm very delighted that she's also joined our ranks here at the Drexel School of Public Health as an instructor in the Global Health Certificate Program, where she'll be teaching a new course in monitoring and evaluation in global health this spring. As a professional evaluator, Tererai draws upon multiple perspectives of evaluation theory and practice. Dr. Trent holds a PhD in interdisciplinary evaluation from Western Michigan University, and she believes that education is a fundamental human right that can free women and girls from the bondage of poverty, which has resulted in high HIV/AIDS transmission among women. Without further ado, it is my honor and privilege to introduce Dr. Tererai Trent.
Thank you very much. Wow. It's always an honor to be here, and thank you for inviting me. Thank you very much. Thank you. So, wow. You know, this afternoon I had a session with some students, and we were talking about HIV prevention. And when it came to time for questions, it was so fascinating that all they wanted to talk about was my life experiences. But, you know, so what I'm going to do today is to talk about HIV prevention, to talk about the evaluation of HIV prevention within the international fora, and particularly looking at Africa. How did I come to be interested in HIV prevention? I remember I was doing my master's in plant pathology, and that time I was working with Bali yellow dwarf virus. It affects plants. It was just fascinating to look at viruses and the way they multiply and the way they work in plants. And unfortunately, it also coincided with my husband being infected with HIV and AIDS. And I knew right away that I wanted to focus on HIV and AIDS. And so for my PhD, I focused on evaluations and looked at HIV and AIDS in Sub-Saharan Africa. Let me just organize my notes here. Somehow okay, here we go. So today I'm going to talk about an understanding of why gender, power, and culture should be core evaluative criteria in the evaluation of HIV prevention intervention in Sub-Saharan Africa. I truly believe that at the core of infectious disease, and especially HIV and AIDS, consideration of gender, culture, and power is central in both producing and eliminating health disparities, and especially within the global health. As I look at the issues of HIV prevention, I realize that gender, culture, and power, these are issues that are never really looked deeply into it, and yet they shape the communities where we work. As we know, evaluation plays a fundamental role as a feedback mechanism that ensures that our programs are based on sound strategies. It also ensures that we have an evidence base to continue with our programs. Also, evaluation, it determines the merits, worthy, and significance of a program. So without that mechanism, we will end up having these programs that we just flash out there in the world, and they have no really significance, they are of no merit, and they will not benefit anyone at all. So today I'm going to share as well, besides the HIV prevention research, I'll also share some of the work that I have done. I've done meta-analysis looking at is marriage a risk factor of HIV and AIDS? I'll also talk a little bit about that. So here is the outline of the things that I'm going to talk about, but I'm also going to be looking at the major players of HIV prevention or of evaluation of HIV in Sub-Saharan Africa. I'll also discuss the social ecology, gender, and social issues that are being ignored. And I'm hoping that by then we can have a much more rich discussion at looking at the M&E, the monitoring and evaluation of HIV prevention programs within the region. You know, while HIV has been a global epidemic affecting 34 million individuals, unfortunately, Sub-Sahara seems to carry the heaviest burden. We have about 23 million people living with HIV and AIDS. Women and girls, they account for about 59% of the infections. And what's more disheartening is that 76% of the infections are found within young girls ages 15 and 24. We also have data that shows that young women ages 15 and 24 are 3 times more likely to be infected with HIV than young men of the same age. And it's disheartening because in some areas where we have high epidemic, you find that some studies are indicating 4 girls, 5 girls being infected. So you begin to wonder, what is it that we are doing wrong? And I think that's what took me on this journey, to reflect if really evaluation is that feedback mechanism that ensures that we can have sound programs. Why is it we still continue to have these numbers? Is there something that is not being covered with our evaluations? And studies in the region, they also point to the issues of polygamy, issues of wife inheritance, issues of genital mutilations. And these issues, when you look closely in the prevention strategies that we have, you hardly find them being mentioned, and yet they are there within the region. And I was tickled to find this photo of the president of South Africa, President Zuma, and he's dancing with his 50th wife. And then you can imagine the power this man has. Do you think that 50th wife will have the power to decide about her own sexuality, to decide about if she wants to use a condom? No ways. A study of 800 men in Botswana found that for every year's increase in age difference between partners, there was a 28% increase in the odds of having unprotected sex. In most of these polygamous marriages, you find the man controls the decision-making, has the decision-making power. The man also is likely to engage in unprotected sex with an unknown status partner. So these are some of the issues that I really felt, gosh, the evaluation models that we have, do they really understand some of these social dynamics? Then I also looked at the theoretical basis that guides evaluation in Sub-Saharan Africa. The evidence based upon which HIV prevention programs are grounded and evaluated seem to ignore all these issues that we are talking about. We have these psychosocial models, theories that we use, and mostly they've been developed within the psychology discipline to understand risk behaviors and behavior change. But the main inherent flaw with some of these theories is one, besides, they have never been evaluated within Sub-Saharan Africa to see if they work. And some of these theories, they were transplanted from US right into these communities. They ignore the social and contextual realities of women and are blind to the gender dynamics, to the issues that I've been talking about, the wife inheritance. I don't know, are you familiar with wife inheritance? Okay, so here is the deal. Here is the deal. Let's say I am married. I have my husband, and Shannon is my sister, and I die. And Shannon, being my young sister, she'll become the wife of my husband. Yeah, you because I die and my husband is still living, you are my sister, you become the wife. It's rampant. It's there in our communities. But we don't know the cause of death. What about if I died from HIV and AIDS? That means my young sister is going to get it. And also the issues of polygamy. If the husband marries 2-3 wives, and usually they are younger wives. I have neighbors at home. One neighbor has 5 wives and the other neighbor has 4 wives. And those husbands, they're still looking for younger women. And you can imagine if they are infected and how the virus would spread within the family. And so when you look at these theories that we use, are they capable of that? These theories were developed here where you don't have these social dynamics. So you begin to wonder if there is need to improve on some of these theories. So I went on a journey. I said I want to look at all the evaluations that are carried in Sub-Saharan Africa. And I want to look at the key players of those evaluations. And the key players are USAID, World Bank, NORAD, UNICEF, UNAIDS. I came up with about 12 of them. And my research questions were, how good are evaluations on HIV prevention interventions in Sub-Saharan Africa? And what are the core criteria that they are using in their evaluations? Is gender, power, and culture a criteria that need to be addressed? And how can we improve these evaluations? So I used a methodology called meta-evaluation. And meta-evaluation really is defined as evaluation of evaluations. Evaluation of evaluations, where you grab these evaluations and you thoroughly look at those evaluations and come to an agreement to see whether they are of merit and of significance. So that's the methodology that I used. So after my search, I came up with about 66 evaluations and 12 donors. And I also looked at formative evaluations and summative and prevention research evaluations. I looked from 2001 and 2009. And the unfortunate part is some of these evaluations are not published. You know, they are program evaluations. So organizations, they have them in their database. And at times I had to call in and get some of these evaluations. And these evaluations are done by different evaluators. Some are external and some are internal evaluations. And then I had to develop a checklist, the checklist of evaluation that was informed by the work done by Scriven. And Scriven is known as the father of evaluations, and he is the one who coined the meta-evaluation. And also my work was informed by Zimmerman with his empowerment framework. The empowerment framework is really sound because it looks at culture and issues of power as well. And then I also was informed by theory of gender and power by Wingard and De Clement. These fellows, they really nailed the issues of culture, the issues of power, and how they shape infectious diseases. And my instrument had 4 major items. Preliminaries, where I'm looking at the evaluations about what they are looking at in terms of when they go into do the evaluations, what kind of background are they looking at, as well as foundation. The foundation also was looking at the methodology that's being used, the causal analysis for that methodology, and whether the evaluator is also arguing for this methodology versus that, and what was the reason for that. And also then the sub-evaluation. The sub-evaluations had 5 items looking at processes. And processes are actually when you look at institutional processes that an organization do, for instance, training, cultivation of knowledge, all those things that would accumulate to impacts or outcomes. So when I looked at the processes we are looking at, you know, when you think about cultivation of knowledge, you're looking about, are they looking, when they do training, are they also considering gender issues rather than just how many women, how many men attended? But I also wanted to look at the value. To what extent are they benefiting? Are they also evaluating? So the assessment, is it also looking at that? And also the outcomes and the cost effectiveness and comparison and generalizability. And then I also had the conclusions, which had also 5 items. And under conclusions, I'm also looking at how the evaluator is summing up the significance of this program. Do they have evidence? Their recommendations that they are coming up with, are they based on evidence, or it's just recommendations, you know? And it's interesting when you read some of these reports, the recommendations, you know, they're the same recommendations. Need more money, need more funding, but is there a basis to say that? It's not there. So these were the issues that I was looking at, issues that were part of my rating, part of my instrument. And then I had to say, well, I've come up with this instrument, but I need validation from the international community. So I worked with global health experts. They helped me to look at the instrument that I had, and it was interesting. I got feedback, and I had to come up with an instrument that really addresses the issues that I wanted to see. And then I had to recruit two independent raters to look at these 66 evaluations. And we did our inter-rater reliability. The average Cohen kappa was 0.56, which meant that there was an agreement, a moderate agreement between the raters. And then I had to develop a general standard of merit scale to judge each of these reports. And I think probably you have, is it table 1 or table 2? If you look at that. So the scale, this is the way it works. So the scale would look at, I would have 0 to 20. If the report scores between 0 to 20, it means it's unacceptable. Then 21 to 46, guide me, I'm here. 21 to 46, did you find it? Is it somewhere there? Yes. 21 to 46. When you look 21 to 46, it means weak. Then 46 to 65, it means satisfactory, and then very good and excellent. So here are the results. So these are the overall results after looking at these 66 reports. None of the reports scored excellent, and only 2 reports scored very good. And I had 4 reports that scored unacceptable. And you'll be interested to know that it was during that time when we had the PEPFAR fund going on. And PEPFAR was one of those reports that scored unacceptable. I think mainly because they were using the ABC prevention strategy. Are you familiar with that? The ABC? A, it's abstinence. B, it's be faithful. And C, it's condomization. Is that right? So when you think about ABC, abstinence, hey, who is going to abstain from sex? It has been tried here in the US, it never worked. Why should it work? Why should it work in Africa? Be faithful. I can be faithful. My husband is a polygamous, and who is going to control what he is going to do? Condomization. Do I have the power as a woman to say, tonight you are going to use condoms? So because these, when you look at those kind of issues and think that a program is based on ABC, and when you come to evaluate that, then you begin to think, the issues of gender, culture, and power, are they really being considered? Do you see these issues in the report? What was interesting I talked about the 4 major items: preliminaries, foundations, sub-evaluations, and conclusions. Foundations was actually rated very good. You know what? Because when you think about an evaluation report, when you think about, because foundations is covering the very same things that grant writers want to see in an evaluation. That's what the donors want to see. So you'd find most of these evaluations, they really do a smart job under foundations. They will tell you the background of the program, those that are being impacted. They would also look at the poverty issues. And it was also interesting that the evaluators, they would get all this background information from the client, and they just copy that and place it straight into the evaluation. Sub-evaluations and conclusions, these are the issues of process outcomes, the issues of significance. Unfortunately, they rated poorly. They rated poorly, and I was not even surprised with that. Then I think there is table 2. Table 2, that you have the one that is green and yellow. Is it table 3? I think table 3. So under table 3, we wanted to see whether there was any significant difference. And as you can see, I really wanted UNAIDS to be number 1. I don't know why. And I was surprised UNAIDS scored very, very lowly. But I was impressed with WHO, World Health Organization. They scored very high. But there was no difference, I think, between UNAIDS and UNESCO. But also because UNESCO, they didn't have that many reports. And that's why you see UNESCO in red. So what are the major key findings? Methodological issues. You know, as I said, their designs for causal analysis were very poor. And the use of data collection instruments, some of the reports, you could not tell what kind of instruments that they had used to gather their information. And mostly, the causal analysis is focusing on behavioral changes and failed to research different pathways of causality and their multiple relationships. As we talked about the issues of, gender, culture, the issues of polygamy, the issues of, some men are more powerful, they would refuse to use condoms. And also it includes, education. When women are not educated, to what extent can they advocate for their own health? And most of these evaluations, they are more quantitative outcome-based. The number of condoms, the number of multiple partners, the number. What about the qualitative side of it? When you deal with indigenous communities, it's beyond numbers. We have to understand the social issues. So, and I think the unfortunate part is because most of these organizations, they use the log frame. I love the log frame. But I think there is need, when you look at the log frame, there is need to translate that log frame so that it can also embed quality issues, qualitative issues. So you don't only focus on numbers. We need to understand the relationships, because this is about gender, about culture, about power. So when you only look at numbers, then you miss that part. That's why it's important to use mixed methods that look at the quantities, and then methods that also look at the qualities. The other issue that I also realized was lack of evaluation capacity within the region, and also evaluator independence. And for some of you who are doing global health, I'm so excited because as you go into the world and start dealing with these issues, you will find out that when you work with different organizations, they'll give you what they call terms of reference. And you have to be very careful when you look at those terms of reference. Some of the terms of reference that I found in most of these reports, they spell out what methodology to do, what indicators to use, and how you do it. In a way, evaluators did not have that freedom to go out of their way and do the qualitative part that is needed when you deal with social issues. So it really affects the quality and robustness of evaluations. And I think evaluators, to some extent, they need to empower themselves because they come in with knowledge and expertise. But it's very difficult because that's where you're getting your money from. So at times it's very difficult to challenge and say, well, I have this methodology that I want to use. And also one of the things was values. You know, when I think about the word evaluation, for me what comes to mind is valuation. There is value. So the values, they come from where? The values that we use, and the values are the criteria or the standard of merit that we use upon which we judge performance of a program. And mostly we use many of these reports, they were using the 5 criteria from the OECD. I don't know if you're familiar with those: sustainability, effectiveness, impact, and what have you. But it's also important to get these values from the communities themselves and try to find a way to marry those 5 criteria that we normally use. Because if we don't include the values that are coming from those that are being impacted by the program, we end up rolling out a program which is not relevant to the community. This was rated very weak. The other thing that also came out of this process was lack of use of gender-oriented values, because it's related to the issues of value. Gender was never an issue in some of these evaluation reports. You'd find gender was probably more mentioned in terms of number of men and women, and that's all they call gender. But I really wanted these organizations to look at the social issues and be able to see the differences in their programs. And the other one is the poor assessment of institutional processes to assess the true outcomes. Because if we only go, most of these evaluations, they would look at the impacts themselves without assessing the institutional processes that build to that impact. It was interesting. So overall, the majority of the evaluations were rated very weak, and we concluded that there is concern regarding the quality of evaluation within the region, the limited evaluation models upon which they are judging performance is very weak, and there is need to improve. Oh, goodness, I jumped something there. So the limitations of these studies, you know, I was asking, who am I to be the judge of these evaluations? While meta-evaluation is very good, but I also had my own biases. So as I was going through this work, I was also asking, am I doing a fair job, or I'm just coming up with my own criteria? Probably I may not have been the best, but I was informed by, guided by expertise from the field, as well as some of the people that have already done some of this work. So it really guided me. Scriven's evaluation checklist, and also Zimmerman's empowerment checklist also helped me. The other limitation was failure to assess the extent to which evaluation reports are being used in the region. I couldn't go and really look to what extent. I was only working with the evaluations that I had, and there's so much that is not written in an evaluation. So you begin to wonder whether I had done a fair job. But I truly believe I did the best with what I was seeing from those evaluations. And it's unfortunate that as we deal with global health issues, you'd find some of these evaluations, they are done and you find them just placed in some shelf, and no one really uses these evaluations. And also time and resources. I wish if I had time and resources and really do primary data collection and get to understand that. Directions of future studies. A comprehensive literature review to examine the real effects of current HIV policies on women and girls. We need to do that. And also to look at the role and intersection of marital status and HIV. And it is the work that I'm currently doing. There is lots of arguments within literature. Some are saying marriage is a bombshell. More women are infected. And some are saying no, actually being single is it's a risk to HIV infection. So I am working on that to really look. I'm doing a meta-analysis, which is different from meta-evaluation. But it's interesting from what I'm observing right now, marriage seems to be a protective factor. Isn't that crazy? After hearing all these things that I've talked about, polygamy, issues of power, yeah. So, and there's also need to increase evaluators' independence, and given the role that they play in providing evidence for the programs that we have. So pretty much, I didn't go in depth into it. I wanted to open more for discussions and questions and get to understand these issues of gender, power, and culture and the role of HIV. Did I hear that? Sorry,
You have to project a bit.
Yeah.
Apparently we don't have the on. Look at that. So let's be clear. This is not the Oprah show. And we are talking about HIV/AIDS evaluation in Sub-Saharan Africa and the effects on women and girls. So here we go. I'll go play this role since we don't have Katie today.
I was wondering what methods the agencies like the HUE use that made them a lot more effective than other agencies.
So some of the methods, most of the methods were around the log frame. So I think it really depends on the evaluator. If they are more willing to spend more time with the communities and get to understand these issues. And it was fascinating to look at some of the evaluation reports where they used a participatory rural appraisal. I don't know if you're familiar with that. And they do needs assessment using simple tools to get this information and really to be able to tell if there is any difference in the way the programs are being rolled out. And some, they just had questionnaires that they would just go in and ask. And what's interesting about when you go into communities and just ask questions, they'll tell you what you want to hear and not the reality. Because some of these people, they like most communities that I know, illiteracy is a huge issue. So at times they require, you need to be sitting down with them and really get to understand the issues.
Have you received any feedback, either positive or negative, from these organizations after they saw this report?
So just few organizations that were interested. And you know what was interesting? This was done way back in 2009. And now things have really changed within the global health. Things have really changed. But that time, I think it also coincided with the Bush era where we had lots of the ABC. But if you look at the literature now, things have changed. And they recognize that, there were some mistakes and there were some issues that they were not understanding very well. And most of these organizations, they will be the first ones to tell you that they were using these theories based from, when you think about HIV prevention, really, even in this country, more strategies were put in place during when HIV was more seen as the gay man's disease. And so these are the same strategies that were probably transplanted to other areas. And now they are realizing that there are these social issues and we need to expand more and improve on the strategies that we use if we want to zoom in and understand developing countries. And I'm sorry to use the word developing. I'm one person who would say no. Yeah.
What role do you think that community participation in evaluation can play in bridging the gaps between the process and impact evaluation gaps that you saw?
I didn't get the last part.
So bridging the gaps between the impact and process evaluations, what role can the community participation play in making sure that that evaluation is accurate?
I truly feel that communities, they own the process and they should own the evaluation itself. We need to make sure that the values upon which we ground performance is actually coming from the communities themselves. They have to be involved, and when we talk about participatory approaches, we have to involve them. Mixed methods are very important. For instance, I know that when you go in and talk to communities and just using questionnaires, there's a tendency only to listen to those who have bigger voices. The ones that are marginalized, they tend to be quiet. And because we get funding from our donors, they may not have that funding to really look at participatory approaches. And I think there is need to understand these issues when you sit and have more time, resources and time to flush out an evaluation process that can empower the communities to be on the forefront. And also, I think it's important that when we use data from the communities, we have to bring it back. There are many times we just roll out an evaluation, we extract the data, We bring it to some offices in Philadelphia or in New York. We write our report. We present the report to the donor or to the client, and we forget all about those communities. It's their product, and they have a right and ownership to that product.
First, thank you for your presentation, being with us today. I have two questions. The first is more about clarification, and I'm sorry if I missed it, but I was curious about how many actual studies there were that you had used from each thing. So I wonder, like UNAIDS, how many you were actually basing this evaluation on, like the actual number of
The actual
reports.
numbers? Ooh, I don't have that information, but all in all, there were 66 evaluations. And I think UNAIDS and USID, they had more evaluation reports than others. Yeah.
Okay, because I am curious how these being average scores, like if there were maybe interventions that were better, that had scored better, and then there were ones that scored way worse, and so that brought down their overall score.
So what I did was just to give you the average scores. Some reports, they really scored very good, but because there were many that scored very poorly, so it affected the overall results of these reports.
Okay.
Yeah.
And then my second question is kind of more abstract, but I wonder, from your experience in doing this and your experience living there and having knowledge of what would work best, I wonder what you might say, what sort of powers maybe could monitor these interventions and sort of make sure that they're doing what they're supposed to be, if there could be a power to do that.
You know, my hope is with you guys. You're still young, and some of you will be going to do global health. And I think it's important, the more we have more people who can understand these issues, the better. Then as we go into this world, especially working with indigenous communities, developing countries, then we can help them to come up with standards that will work. And at times, I think that is just sheer ignorance. To some extent, because we feel that we have the expertise and the communities, they don't know. And at times evaluation is mixed up with research where you think, how can they understand the statistics? I just need to go in and get the data. But evaluation is very different, because evaluation is about learning, it's about improving. But how do you improve if you don't get the evidence from the communities themselves?
Dr. Trent, thank you for your time with us today. I'm a faculty member here in the School of Public Health, and I'd like to ask you a question unrelated to your presentation.
I know.
I'm sure you've never had this one. My question is about your title slide. So on your title slide, I observed that you are getting an MPH in 2013.
Yes.
Is that correct?
I am too old, yes.
So let me ask my question first, because I'd like to, most of the people in this room are students in an MPH program. And for someone who already has a PhD, why did you go back to get the MPH, and what does it mean to you?
So here is the deal. My goodness. It's interesting. So when I did my PhD in evaluations, I realized, I had opened a can of worms looking at HIV and AIDS, and I had no idea about epidemiology, about biostatistics. So I decided, well, despite the fact that I'm 50-something years old, 60, I need to go back to school. So I went back, and I'm with UC Berkeley. Yeah. You are never too old to learn.
Hi, thank you for the wonderful presentation. I'm looking at this list of the donors, and you're listing a lot of major development agencies around the world, from many countries. And I'm just wondering, is there a way, do you think, that maybe WHO or some other group could provide leadership to the development community per se, so that these types of issues you're raising in terms of doing more qualitative work, maybe using focus groups or structured interviews or things like that to really tease out this issue more about the gender and power? Do you see any hope that this might, become a criteria or somehow become more acceptable in terms of doing not just quantitative analysis, but more qualitative?
Yeah, I think it's already happening right now. I think there are many scholars that are out there that are questioning the kind of development, the kind of prevention strategies that are in place. And so you'll find now things are really, really going in the right direction. But I think that the more we have more people really believing in qualitative methods, the more we are better off. I love quantitative stuff, but I think it takes qualitative stuff to move this world. Yeah.
I have a question that I hope that you can address this, but you had talked about a lot of the HIV rates for younger girls in particular, and sort of looking at the intersection of genital mutilation. And I'm wondering if you can talk a little bit more about that, but I'm also curious if aid agencies are willing to tackle that, given that it is often politically sensitive and controversial topic to be looking at that.
It's interesting. I remember looking at reports as far back as late 80s. Some of the scholars were writing about sex in Africa. And some of it's devastating. And I was angry reading some of it, like, Africans, all they do is sex. That's their game, and that's why we have so much HIV in Africa and all these cultural issues and the way they were being written. But you know what? I always say there's more sex in Hollywood than any other place in this world. And why is it we don't have those high numbers of HIV? So now because of that history, and because there were others who came on the forefront and say, you know what, it's unfair the way we write up this stuff about Africa. Now the really issues of gender, power, and culture, people are kind of now shy to talk about it because they're afraid that it's more of the blame game. We cannot run away from it, because we have those issues. When you think about genital mutilations, they are being carried out by women, and the exposure to HIV, AIDS is very high. And yet it's part of the culture. This afternoon I was talking to some students, and they say, then how do we change people from their culture? And I always, I'm not very good at talking about culture, but let me say this. There's a difference between culture and customs. When we built our houses here, we want a custom-built house. We want it to be designed this way and that way. So there's culture, there's customs, and customs are put in place by those who benefit from it, and mostly men. Men, they want a virgin. They want a young, docile woman. They want that. And they would even go to the extent of making sure that we cut off the clitoris so that we reduce the pleasure in this young girl. So those are customs. But, culture, it's about human rights. I think culture, for me, the way I see it, and I may be wrong, it's about the positive things that comes out of a community. So we really need to talk about these customs and the culture that can help us to look at positive things, look at negative things, and how best can we move forward. And I truly believe that the solutions as we do these evaluations, and we truly believe in the qualitative approach, the focus group discussions, then we can understand some of the positive things that come out of the culture and some of the negative things that come out of the culture. But if we don't have time to sit down with these indigenous communities or, developing countries, then we miss something of importance.
This is in response to the question on the qualitative research. And I'm working on my dissertation, and it's a qualitative study. I'm actually doing a secondary data analysis, former faculty member, Dr. Lisa Boleg, and it's working with African-American heterosexual men. And what I'm finding is that my hopes are that more scholars are going into qualitative research because there's so much rich data there. And what I'm seeing is that some of the men are discussing that if they don't use their own condom, then they're probably not going to use the condom of their partner. A lot of men are very, they don't trust these women using their own condoms, and it's just such a barrier to what we're empowering our women to do. Make sure you have your own condoms. So I'm kind of already looking at, yes, it's important to focus on the men, but how does this impact what we're teaching our young women? And hopefully that my research will help to, influence additional tools to get that quantitative information, but also to influence the development of interventions and how we tailor our messaging for, men and women.
Yeah. I think that's important. And we, the more you look at the qualitative issues, the more you really begin to understand some of these dynamics, and the more we can have programs that are relevant to these communities.
I had a question that's going to be very naive.
Okay.
You're talking about polygamy, and you're talking about President Zuma, for example, with wife number 5 and how polygamy benefits men. It seems like it benefits some men, because if birth ratios are about 50-50, it's not entirely, but it's about 50-50, that means that there's, 4 men out there going without wives?
It benefits older men, because you'll find these older men, they go for younger women. So it means the younger men, they're just left without partners. So what they do is just to forage around and just sleep with anybody, because women are being taken by these older men. That's the way I look at it. Yeah. But let me also say that the issues of polygamy are not as, you find them in some communities you don't. And as women are getting educated, the more they are looking at these issues and thinking, gosh, you know what? I don't need to be married by a polygamous man, because at times it's choice, but in most cases, because of poverty, it forces women to go and get married to these men, because they don't have the education, they don't have the source of income. And some of these men that are polygamous, they are local businessmen, they have the money, and you know what? Girls, they go for them. Yeah.
Okay, well, I just want to take this opportunity to thank Dr. Trent. Again, she spent the day with us. We have some time tomorrow. We really enjoyed you spending time with our students for lunch today, and your talk was just absolutely phenomenal. I think you've given us a chance to really discuss a number of things that really relate closely to our mission here around human rights and social justice. So I want to really take this time to thank you so much for this, and we're looking forward to our interactions as you're teaching next term, so some of you in the room will have a chance to interact with her.
Thank you. Thank you very much for having me. Thank you.